procedures space. And so, yeah, the third point is what I just mentioned, the scope. When we talk about information security and the context of international development, LMICs, we should really think of a scope that is broader, not just cybersecurity, not just digital data, but the entire information system, meaning, again, paper records, and everything that is part of the routine operation of the project that we are managing. Next slide, please. So just to clarify it again, to reinforce that message, in terms of information security, we can think of it in two big axes. So there's the big cybersecurity section that we are all familiar with that has to do with digital hygiene, using strong passwords, locking up your screen when you walk away from your computer, making sure that if we are developing software, we implement security by design, that the deployment of the digital solutions are secure. All those things are included within cybersecurity. On the other hand, there's the operations aspects that has to do with the process guidelines. How do we protect physical spaces? How do we protect physical records within our project? So as you can see, they're not necessarily inclusive of each other. They're two separate areas of work. And so having said that, I have two questions for all the participants in the call. For your projects, do they include information security policy? Feel free to answer yes or no. And a follow-up question, do these projects include both areas of risk mitigation, meaning cybersecurity, digital, but also operational security? So feel free to, yep. So I see two no's, one yes. Yes, perfect. Great. So I see, yeah. So some people say no. Okay. Great. Thank you. Yeah, so that is expected, and especially because, again, the environment where we are right now, it's so full of things digital, everything. Like I feel like in LinkedIn and on the web, we get so many new resources, new guidelines, new just resources to do with cybersecurity, how to protect digital data. But there's definitely a need to still think about security in the context of things that are not digital. Next slide, please. And so to wrap up this introduction, we want to think of an information system from the organizational standpoint, from the structure, not just the digital solution, but the organization approach, meaning everything that is needed to collect, to process, store, and distribute information. And that system will be composed of tasks, people, roles, and technology. And so we need to protect all of those. And when you're working with a health intervention, you will see that all these things come into play. You have to train people that are doing different tasks. You have M&E officers, you have data entry clerks, and each one has their own role and their own level of access and the things that they are supposed to be doing. And some of those things can be automated and can be replaced using technology, but not all of them. So making sure that we have a clear picture of all these different components is important, because only then we will be able to ensure that things are being done securely. So yeah, so for the elements, that need to happen within the system, we need to think about the operations, who has the right to do what, and then in terms of ensuring that everyone is doing what they're supposed to do, we need to implement controls. And to speak a bit more about controls, we're going to move on to the next section. Next slide, please. They had to do with controls and certifications. So in the area of controls and certifications, next slide, please. we know that there's very extensive products from the international standards organizations, for instance, ISO. I think most of us are familiar with the 2700, 27 something and one standard for information security. And all these certifications provide a recognized set of controls to help organizations show their security standing, saying this is how much effort we're putting into this. Obviously, these are open resources. Anyone can invest time and resources to comply with the certification and certify themselves by an external entity. Obviously, this is not mandatory by any means. It's more industry driven. So it is, at the end of the day, something that is visible to peers to see that an institution or an organization has completed a certification. Next slide, please. And so, for instance, going back to the ISO 27001 certification, as you can see, it's a very extensive document with over 93 controls that are divided in 4 different domains. I'm just showing this for illustrative purposes. I'm not going to dig into it. But just to say that our company obtained this certification last year. And we obtained the version from the year 2013, which has a slightly different diagram than this version that you're seeing. The diagram is from version 2022. But the one thing that I wanted to point out from this certification is that, as you can see, it contains controls for different areas of the system, not just technology. As you can see, technology is one of the 4 components, one of the 4 axes. But then the other 3 are not technology and have to do with facility security, non-disclosure agreements, how to protect assets, how to use them, and policies. So again, this reinforces the message that we just talked about. Cybersecurity, or security, is not just cybersecurity, it's all the components of the system. And as you can see, the system is not only technology, there's physical controls, controls for people and controls for the organization as well. Next slide. And then, as implementing partners for PEDFART, we also have to abide or follow the rules from USAID. USAID has a number of regulations that have to do with what we, the companies that do contract work for USAID, are beneficiary countries, how are we supposed to do our work? And the 2 guidelines that are probably most familiar to most of us is the ADS 540 and ITS 571. They have to do with the need for us to share our products and the raw data that we collect with USAID, just to comply, but also to share the knowledge and build upon that knowledge for others to use. This is only to show that each organization can do things their way. Internally, USA has a lot of more automated directives, ADS numbers. If you Google them, there's like a lot. So there's a lot of compliance going on there. And this is another approach. There obviously is a very large organization. They have a system for security certification that is different from the ISO certification that I just showed you. But this is just to illustrate that there's different approaches, different ways of implementing controls, and it really depends on the organization. From that standpoint, we are at a crossroads. Can we go to the next slide, please? Next one. We are at a crossroads because we are an organization that has its own, certification. We do work for USA that has its own regulations and controls, and we do projects with different countries. But those countries have their own policies as well. May have those policies. Some of them don't have any. But on top of that, we also in these projects have to interface and collaborate with other implementing partners that are already on the ground. And those implementing partners, those other organizations, also have their own way of doing things. So yeah, this is, as you can see, is a very complex environment. And the challenge is how do we ensure that we provide information security in that context where there's so many moving pieces to it. So our thought here is that the in-country projects need to respond to the local capacity, laws, and context. So even though we have, we're like 27,001 certified, we don't say our project is 27,001 certified because that's impossible. The country itself has a different context, different infrastructure, and we don't have that reach. We cannot control what goes on in there. So we had to build something completely separate that responds to the local capacity and local laws. And so to build that product, that information security product that responds to the local capacity and the local context, how do we go about doing that? And so our approach and that we propose today is to stick to the things that we saw in the previous slides with the concept of an information system, the larger concept, the concept of the controls from the ISO certification, that it all comes down to tasks, roles, peoples, and technology. Next slide, please. So it's starting with tasks. What do we mean by thinking that we need to think about tasks? Well, basically understanding from the project that we have in front of us and the country and the context and the laws, understanding what are the programmatic needs and expected outcomes, understanding, have a clear idea of what are the information flows, who participates, who are the stakeholders, and from that clarity, also identify what data can be at risk, what documents are within the system that need to be protected, what data do we need to complete our work, and do we need to interface with actual participants, or that's not necessary. So all those things need to be documented and understood in order to identify the tasks. And then from the tasks, we go to the roles, which is basically defining the responsibilities, checks and controls to ensure that people are doing the work that they're supposed to do. So basically deciding who needs access to what data and how long do we give that person that access. Next slide, please. The third point around technology, as I mentioned at the beginning, some of the tasks can be automated. And for that, obviously, we always propose to use well-documented and tested global goods that already have best practices built in, like two-factor authentication, enforced passwords, and all those kinds of things. So rarely we will find a situation where we need to build something from scratch. And for the most part, it's not advisable because there's so many things that go into information security that you might as well just take something that is already well documented and supported and tested that has all those pieces already in it. But the main point here with technology is that it's just one tiny piece of the puzzle. It's not going to solve everything because most of the system, the project, the program is not going to be covered with that solution. It's just a tool that is going to facilitate part of it, but not all of it. And lastly, people. We need to manage change. So we're talking about the context where we probably working with different implementing partners. Each one has their own way of doing things. We're probably hiring new people coming to us. We're working with the government, with health workers. So we need to manage all those expectations and way of doing things. We need to be clear about our goals, how we are going to go about protecting information end to end. What should come out of this effort, what's in it for them, what do they stand to gain out of this exercise, and obviously provide capacity training and documentation for all of this to be put into practice. Next slide, please. So all of this has been very theoretical, and I would like to now offer you a sample scenario, and for that I hand it over to my colleague, Noni.
Thank you, Eric. Hi, everyone. Maria here. Good morning, good afternoon, good evening. Okay, so we'll just take a look at information security implementation in practice using the example here. So we have an example that says company has been hired to improve, we've been hired to improve linkage to care for HIV patients at community level in Springfield, a country with 10 million inhabitants and a nominal GDP of $5,000 per capita. And the client is requesting to demonstrate evidence of information security protocols and guidance to protect clients' data. Now, these are questions that would be asked in the context of implementing this. Would ask questions like, what are the tasks needed to complete our projects? Which people's skill sets are needed in the team? What roles would we need to play, and how would we need to train? How do we need to train them? Do we need to collect data? If so, how would the data be collected? Is it in paper forms or web forms? What type of data would be needed? Does it require date of birth, addresses, that is patient identifiable information, and why are such data needed? Are there local data protection regulations that should be incorporated and adhered to? So these are questions that will be asked in practice when implementing digital health systems and ensuring that information security protocols and guidance are adhered to. Next slide, please. So this is just a sample based on the example of tasks and controls that will be implemented. So we have tasks for registering a patient and triaging a patient. Now we're looking at demonstrating HIV epidemic control in a country based on the client's request. And then we have different roles, but the role we have here is the nurse data entry clerks, and the technology or tool that will be used to collect this data would be paper tools. And we have controls like signing of non-disclosure agreements. This would include data protection regulations, and also would have to refer to any National Data Protection Acts or donor regulation, as the case may be, depending on country of implementation. And then you also would require, this will also require the nurse to account for and ensure that the papers are securely stored. And then tablets at the end of the workday. So all of these controls will be required of this role, this nurse or data entrance role. And then the nurse would also need to confirm and sign the facility log, as well as report any incidents that may arise. So these are some of the controls that will be required of this role. So after identifying the roles that are required based on the project, these are some of the controls that would be that will be guiding everyone who is involved in that project based on their roles and responsibilities. We also have another task that requires tracking of progress at community level based on the implementation of the program. And people that will be responsible for such tasks, we look at having the M&E officers or data collectors who will be responsible for tracking progress of implementation at the community level. And would require the use of an Excel tool to document these records. The controls that will be required for this role would be would require that the M&E officer ensures the Excel files are passworded, so they have password protection, and if there is any need for them to share these Excel documents, ensure that the documents are shared using secure methods, that is using a corporate online drive and not a public drive that could expose the records to security threats, and also ensure that there are no public file sharing services. Also ensure that the use of only official email accounts are being used in sharing these files. So another task that we'll also look at is providing access, assessing progress review of implementation, and also campaign priorities. The role that we have here is immunization doctors, and this would be documented. This would require documentation in the Excel. So controls we have here would require that the director organizes or mandates training for team members, investigates documents and also documents that are reported based on incidents, and also verifies that everyone in the team complies to national and donor policies. Next slide, please. Okay, so we go into the data file experience. Data file being a global health industry support mechanism. It's a project that is implemented by Palladium. We also have GSI Research and Training, Right to Care, Pendulum, DT Global, John Hopkins, Cooper Smith, JMB Health Systems. So basically, we just look at an overview of the data file project, using this as a case study in the implementation of information security processes. As data file, we provide digital health system enhancements and scale up of data systems, and also supports the host government and also USAID as a donor in decision support interventions to optimize healthcare performance and efficiency at all levels. Also supports data analytics to enable the precision of programming and resource optimization, and also supports the government of Nigeria to set standards and ensure that system integration and data access is made available, including data security as well and quality of this data. Next slide, please. So currently, DataFi is working with local stakeholders to optimize in-country health information systems in more than 20 countries, providing different digital health and data support program implementation across these countries. Next slide, please. So we'll look at the DataFi's approach to information security in terms of our implementation here in Nigeria. So basically what we do, we engage with stakeholders. Stakeholders range from the implementing partners, the donor agencies, as well as local authorities, government of Nigeria, as the case may be. We also ensure to understand the context of the host government in terms of its digital maturity, its local regulations, policies and guidelines. So these actually are steps that are taken in our implementation process based on program implementation to guide us in the implementation of these digital health systems. Also required the definition of scopes, people, process, and data, assessing risks, both operational, digital, and non-digital risks, and also designing controls and guidelines, as well as sensitization and training of users at different levels. Next slide, please. So here we're looking at DataFi's approach to information security in low resource environments. So working with other implementing partners, and also the government of Nigeria, in this case, to assess the local context and develop information security guidelines. What we have done is to ensure that we have local data protection regulations available. So these are actually part of what we have developed in terms of information security guidelines and SOPs, which we have actually developed and also sharing with the implementing partners to ensure compliance. We ensure, so the SOP actually specify all of these that are highlighted in this slide, how records are shared with implementing partners during implementation, as well as physical and digital records, how they are stored, irrespective of whether these records are documented using paper form or web forms. So we have also process of identifying and reporting incidents to data security breaches, requirements of non-disclosure agreements for staff and volunteers, also authorship agreements with external entities who are supporting the development of knowledge products. So we have all of this highlighted in the SOP, and this SOP document is built in collaboration with the local authorities. In this case, is the government of Nigeria. Next slide, please. As DataFi's approach to information security, we also work with countries that have digital solutions at health facility level and develop guidelines that also includes procedures for securing their local area networks, procedures for securing their workstations, documentation of different user groups and the rules, user management rules and rights and permissions to these digital health systems, procedures for guiding the management of user roles and responsibilities to enable the management of these user accounts, and also procedures for roles and responsibilities for data backup procedures and restore procedures. We also have procedures to ensure that the electronic medical record components are up to date and with the latest security patches that are released to these partners and users. So all of these SOP and guiding documents are all collaboratively built with the local health authorities. Next slide, please. So speaking to the information security SOP and guidelines that have been developed, that's actually part of one of the controls that has been put in place. Eric has mentioned some controls that are required in ensuring that information security measures are adhered to, and the compliance of it is also in place. So we have having these guiding documents and SOPs are also part of the people controls, aside from the system controls that are implemented at the point of developing the systems. Here is an example, one of which is multiple implementing partners who have access to the digital systems that are developed. In the Nigerian context, for example, we have these partners who support health facilities at different states, and also support the users at this health facility. So we have multiple user levels, and when these systems are developed, so because the implementing partners have direct support to the facility users, so those partners are actually responsible for ensuring that, these guidelines and guiding principles are adhered to at that facility level. And then the systems are assessed at the facility level across the country. where the implementation is supported. And also, we also have services provided at the community level. So we have different levels of access to these digital health systems. We have the community level, we have the facility level, as well as the implementing partners who provide that level of oversight to these facilities. Next slide, please. So in all of this, as much as we try to ensure that we are having this information security controls and policies as well as guidelines in place, we also have some challenges based on context and in-country implementation processes and ecosystem. Some of which are the fact that as DataFi, we have less control in enforcing that these SOPs are adhered to, because we, as much as are responsible to ensure that we have all of these in place, we don't have the direct, we don't have that direct what's the word? We don't directly interface with the users at the facility and community level. So we have controls at the level of ensuring that the implementing partners who are responsible for providing the support at the facility and community level have signed the non-disclosure agreements, have also provided the requisite trainings to the different users at the facility and community levels, as well as the implementing partners being trained themselves. So these implementing partners are the ones who actually provide this oversight to the facility level users. And then you have also different organizational policies in implementation. So different organizations have different organizational policies and how they implement across these different partners. So even as much as having the controls like user management, user management, role management, and privileges, ensuring that these systems have good password protection and all of the requirements in the SOP. It's very minimal to ensure that all of these are very much effective at the community and facility level. So these are some of the challenges we've actually had to deal with, and trying to also provide the necessary support to these partners, as they are the ones who actually create the users for the facility and community level users. So yeah, so I'm going to hand it over back to Eric.
Thank you, Nonia.
Thank you.
Thank you, Nonia. So just to wrap up the conversation, just three big thoughts here. The first one is that information security, again, is not just cybersecurity. As we had discussed today, there are a number of components that have to do with looking at the system from the organization standpoint and all the components. And obviously, each system, each organization, each country is going to be different. So there's no one-size-fits-all solution. You really have to understand the context and see what you had to work with. So yeah, thinking of security in the local context is probably the most important thing when implementing development projects, especially digital health, to make sure that we take into consideration the constraints, but also the stakeholders with each implementing partner, the local authorities have and can contribute to this effort. And lastly, yeah, the approach that we have shared with you is based on it's nothing new. It's what's already being implemented through recognized certifications, security certifications, and it's all about understanding the context in a way that you can identify what are the people, the processes, the tasks, the controls that need to be put in place in order to put forward the information security that we need. With that, I believe we have arrived to the last slide. Next one. Yes, so yeah, thank you all for your attention, and we'll be happy to answer your questions or share your comments.
Thank you, Eric and Nonye. And yes, if anyone has any questions, feel free to type them in the chat or raise your hand and then just unmute yourself. I believe you should be able to do that. And yeah.
Yeah, I see a question. I don't know if everyone sees. Go ahead.
Yeah, this good catch, Eric. It's in the Q&A. The event said this was going to be focused on information security when digital solutions are not available, exist only in paper form, etc. However, this presentation focuses on digital solutions and standards. The only piece of information related to paper security is to sign an NDA and store paper securely. Is this all we can do? So essentially, Eric, Nanya, I don't know which one of you wants to take that, but there's the comment that, there's maybe more detail is desired on how to specifically secure the security of paper records and physical records.
Yeah. No, maybe if we can go back to slide 24.
Sure. Tell me when to stop. 24, you said?
Yeah, that one.
Yeah.
So exactly this one. So yeah, security and low resource environment. So here we are assuming there's no information system, there's nothing digital. So first off, we're just showing up to implement an international development project, a health intervention. So the first thing is to look at what are the local data protections and regulations? How is our project going to comply with those regulations? What things we need to do to be in compliance? How do we need to adjust our tools if we are using paper forms or tablets or whatever it is? How do we make sure that we are complying with the local regulations? Then ensuring that we have a clear understanding of how we are going to collaborate with implementing partners that are already in country. Each one is going to be using their own tools, their own paper forms, their own ways of managing their information. There's no one single digital system. They might just be giving us a printout. They might be giving us an Excel file. So there has to be some understanding and some control to make sure that that information is handled properly. Also how physical records and digital records are stored at the facility level where we are going to be working, ensuring that people are properly trained so that records containing sensitive information is not left outside at the end of the day, making sure that everything is properly stored under lock and key. Ensuring that we train our collaborators and give them a contact, someone to call in case something happens. In case, let's say, a community health worker on a site visit lost the line list, that has to be reported. So who does that person call? Making sure that that's already communicated and it's well documented. And preparing a non-disclosure agreement that the person who has the question already alluded to. Obviously, that has to be signed by the staff and volunteers that have access to private data. And there might be a need for our data or the data that is collected through the program to be used for external research or publications. And there's also potentially the need to create a document that establishes the conditions for that sharing to happen. So yeah, so this is basically what we have for non-digital. And as we mentioned, this is part of the SOPs that we prepare and help countries develop. And as you can see, it's not necessarily focused 100% on technology. And I hope that answers the question.
Yeah, and it is a good question, and there's obviously more that could be said on physical records specifically. And if I don't know who asked that question, if they're still on the call, but if you feel still unsatisfied with that level of detail, feel free to reach out via email to Eric or Nonye, and we'll be happy to provide more specific guidance and context on physical records specifically. Any other questions? I don't believe there are any.
Okay, so just to also throw more light on physical records security, talking about, or rather speaking to the question that was asked. So in this context, and with the example that was given, in terms of the use of, so the example was speaking to the use of physical records. So like Eric has also mentioned, all of these guidelines actually speak, not only speaks to the use of digital health record system, but also for physical records. And here we have experience of most of these users actually using the physical records to document patient health records. And that is part of why we're actually advocating for to ensure that they comply to these guidelines and policies, and ensuring that these records are well secure, and also ensuring that they're able to, as the Datafy, as the organization or the partner that is implementing, ensure that they are able to communicate through the implementing partner on any issues regarding their records, and also the use of the SOP as well as non-disclosure agreement actually helps to guide them on that. This is also going to be done alongside trainings to these users at these different levels. So it's not just for the use of digital health records, but also for those who actually use paper records. Yeah, thank you.
Yeah, thank you. That's a useful additional context on it. Yeah, if there are no other questions, I'm happy to then pass it back to Carol to close this out. And I just want to thank our speakers once again, as well as everyone for joining us for this conversation. It is Cybersecurity Awareness Month, something I probably should have mentioned at the beginning of the webinar. So very timely topic, and of course, there's never enough to be said on it. And with that, over to you, Carol, to close us out.
Thank you very much, Laurence, and the other speakers from Palladium. That was very insightful presentation. All the participants that are attended, thank you very much for taking the time to attend our monthly webinar. We come to the end of today's webinar. Next month, November 15th, we'll be hearing from JSI on digital transformation lessons learned from the USIG funded T2 and it's digital health activity. This is going to be hosted by JSI. Once again, I do like to encourage you to join the Global Digital Health Network. The link is there. Also, if you're already a member, please encourage those who have not joined to join the network for this and many more others to come. Also, we'll be looking forward to seeing you in Washington in December for the Global Digital Health Forum. Thank you so much for attending. Thank you, Terry, for organizing, and for the Palladium team, Laurence and the team. Thank you very much. Have a good rest